Malaria is a life-threatening disease that usually thrives in tropical countries like Africa and Philippines. Malaria is transmitted through bites of female Anopheles, which carries the parasite. Of the 5 parasite species that cause malaria in humans, Plasmodium falciparum and Plasmodium vivax are the 2 most dangerous. Here are some quick facts that nursing students need to know about malaria. Definition: malaria is a parasitic infection caused by the bite of an infected female Anopheles mosquito. It is most commonly found in tropical and subtropical regions. Symptoms: the symptoms of malaria can include fever, headache, chills, muscle aches, fatigue, nausea, and vomiting. In severe cases, it can lead to organ failure and death. Diagnosis: malaria is typically diagnosed through blood tests, including a rapid diagnostic test and a microscopic examination of a blood smear. Treatment: malaria is treated with antimalarial medications. The choice of medication depends on the severity of the infection, the type of parasite, and the patient's age and medical history. Prevention: preventive measures include the use of insecticide-treated bed nets, mosquito repellents, and prophylactic medications for travelers to malaria-endemic areas. Transmission: malaria is primarily transmitted through the bite of infected Anopheles mosquitoes. It can also be transmitted through blood transfusions, organ transplants, and from mother to unborn child during pregnancy. Complications: malaria can lead to severe complications, such as cerebral malaria, anemia, acute respiratory distress syndrome, and kidney failure. Risk factors: risk factors for malaria include living in or traveling to malaria-endemic areas, not using protective measures such as insecticide-treated bed nets or mosquito repellents, and having a weakened immune system. Public health impact: malaria is a significant public health issue, particularly in sub-Saharan Africa, where it is a leading cause of death among children under the age of 5. Control and eradication efforts to control and eradicate malaria include the use of insecticides, indoor residual spraying, and mass distribution of insecticide-treated bed nets. A vaccine is also being developed, although it is not yet widely available. Hyperthermia. Nursing diagnosis: hyperthermia related to increased metabolic rate secondary malaria as evidenced by body temperature above the normal range, localized redness, raised heart rate and respiratory rate, appetite loss, weakness, and seizures. Desired outcomes: the patient will keep body temperature below 102.2 degrees Fahrenheit, 39 degrees Celsius. The patient will maintain normal ranges for BP and heart rate. Intervention: check for signs and symptoms of hyperthermia. Rationale: check for signs and symptoms of hyperthermia such as flushed face, weakness, rash, respiratory difficulty, tachycardia, malaise, headache, and irritability. Keep an eye out for complaints of perspiration, hot, dry skin, or feeling excessively heated. Intervention: monitor the patient's blood pressure and heart rate. Rationale: with the onset of hyperthermia, heart rate and BP rise. Intervention: every hour, as often as recommended, or whenever the client's condition changes, take an accurate temperature reading and record it. Rationale: making correct treatment decisions and identifying temperature trends will be made easier by using a consistent temperature measurement technique, location, and tool. If necessary, use 2 temperature monitoring modes. All non-invasive techniques for determining body temperature have accuracy and precision variations in comparison to core temperature techniques that are unique to each type and technique. It should be noted that there is a 0.5 degree Celsius temperature discrepancy between core temperature monitoring and other non-invasive techniques. Intervention: keep an eye on the patient's fluid intake and urine output. To check on the patient's fluid condition, if they are unconscious, central venous pressure or pulmonary artery pressure should be taken. Rationale: fluid resuscitation may be necessary to treat dehydration. The patient is so dehydrated that they can no longer sweat, which is essential for evaporative cooling. Visit us at nursestudy.net for over 1,000 free nursing diagnosis and care plans.